When we think about really big health challenges, it's easy to feel overwhelmed, right? But what if I told you there's a simple but really powerful framework that can help us tackle pretty much any health problem? Today, we're going to unpack the 3 tiers of prevention and learn all about thinking upstream.
Okay, let's jump right in with a little scenario. Picture this. You are the mayor of a small town. It's the middle of summer. Everyone's out enjoying the local swimming hole. But then, a problem. People are coming down with this weird, persistent rash after they go for a swim. As the mayor, everyone is looking at you. So what do? What's your plan?
You could really tackle this in a few different ways. The best way to think about it is to imagine you're standing by a river. You could focus on helping the people who are already in the water, struggling. Or you could station someone at the riverbank to catch people right as they fall in. Or you could hike upstream and figure out why people are falling in to begin with. So let's break down the mayor's options here. First, there's the downstream plan. This means setting up programs and maybe some support groups to help people manage these awful rashes they already have. Then there's the riverbank plan. You could have someone, maybe a lifeguard, check swimmers for the very first signs of a rash to treat it super quickly. But then you've got the upstream plan. Go find what's causing this, find the source of the chemical in the water, and stop the pollution for good. 3 very, very different ways to handle the same problem.
Now, what's so cool about this little story is that it perfectly maps onto a core concept in public health. Each one of the mayor's intuitive plans actually has a formal name, and together they make up the 3 pillars of prevention.
And here we go, this is the big reveal. Helping the folks who are already dealing with those long-term rashes? In the public health world, we call that tertiary prevention. Checking swimmers for those early signs to lessen the impact, that's secondary prevention. And the most proactive move of all, stopping the pollution before anyone even gets sick, that, my friends, is primary prevention.
Let's make sure we've got these down. So, primary prevention, this is the ultimate upstream strategy. It's the mayor hiking up the river, finding that polluting pipe and shutting it down. The whole point isn't just to treat the problem, it's to make sure the problem never, ever happens in the first place.
Next up, we've got secondary prevention. This is our riverbank plan. The problem, the pollution, is already out there, so our focus has to shift to catching it early. Think about that lifeguard, checking swimmers right as they get out of the water, spotting that rash at stage 1. It's all about reducing the damage before it can get really bad. And finally, that brings us to tertiary prevention. This is our downstream action. It's about helping the people who are already struggling. The illness or injury has already happened, and it has lasting effects. So the goal here becomes management, providing treatment and support to improve the quality of life for people already dealing with it.
Okay, so this is obviously about more than just a made-up swimming hole. This exact framework, primary, secondary, tertiary, applies to the biggest real-world health issues we face every single day. Let's take a look at what this looks like in reality.
This chart just lays it all out so clearly. In the primary column, the before, you see things like seatbelt laws and vaccines. These things prevent injury or disease from ever happening. Then in secondary, the during, you've got things like mammograms for early cancer detection, or giving an injured worker modified duties to prevent a worse long-term injury. And finally, in tertiary, the after, we see things like cardiac rehab programs and support groups, which all help people manage conditions they're already living with.
So we've got these 3 powerful approaches in our toolbox. But is one better than the others? Where should we really be focusing our time and energy to get the biggest impact? Well, the answer lies in looking upstream.
Now, it is really important to say that for most complex health problems, you absolutely need all 3. It's a team effort. You need support for people who are already sick, you need early detection methods, and you need to prevent the problem in the first place. It's definitely not an either-or situation.
But, and this is really the key takeaway here, experts all agree on this one thing. The further upstream you can go, the more effective you're going to be. Stopping the problem at its source, that primary prevention, is what delivers the most powerful, the most lasting results for the health of an entire community.
So that leaves us with a really interesting question to chew on. This whole upstream framework is obviously a game changer for public health, but it doesn't have to stop there. Just think about all the other complex challenges we face, in education, the economy, our environment. Where else can we stop just reacting to problems downstream and instead start traveling upstream to solve them at the source?